Hey, Dr. Kyle here, founder of Shift Health Center. I wanted to talk just a little bit about sleep. And the reason I want to bring this up is because sleep is such a problem, especially in our country in the United States. People do not get quality sleep or they do not get enough sleep. Really, the regular adult should be having between 6 to 8 hours of sleep, and really that can vary by person. Some people do okay on about 6 hours, some really need to get closer to that 8 hour mark, so that's something that you'll have to test and play with. And I will also say that the quality is just as important or more important than the total time of sleep. We want to make sure we're getting quality sleep where we get into a deep sleep cycle. When we're in a deep sleep, that's when our body actually heals tissue. So if we're missing out on that and we're not getting into a deep sleep, we are not going to be able to heal our tissue, and it's really going to impede our healing progress. So just a couple tips for you. Number one, you got to have the proper mattress, right? If it's really old, you may want to consider replacing it. Some people do better on a firm mattress, some people do better on a soft, so you're going to have to kind of play with that and test it. But if you have a terrible mattress, you're going to be having issues no matter what. We want to try to limit artificial light as we get closer to bed. There's things like blue light blocking glasses. They need to have an orange lens on them or else they're not real nighttime blue blocking glasses. If you can wear those 30 to 90 minutes before bed, that's really going to help your hormones with melatonin and get you into a deep sleep cycle before bed. So on that same token, if we don't have those glasses on, we want to eliminate any artificial light like TVs, computers, phones, anything like that hitting our eyeballs and hitting our retina. An interesting fact is people who don't get enough sleep actually messes with the hormone leptin. So people actually tend to eat more when they don't get enough sleep. So if you're someone maybe struggling with weight gain or hoping to lose a little bit, you need to make sure that you're getting quality sleep, or else your hunger can actually spike up from that as well. So there's lots of things when we look at that. Regular exercise is another thing that can actually improve your sleep quality. So typically we don't want to exercise right before bed. That would be a no-no. But if we can do it midday or morning or anything along there, exercise on a regular basis actually improves our sleep quality. So those are just some tips. A big one, of course, is going to be chiropractic care. So when we're getting adjusted, it actually puts us more into what's called a rest and digest part of our nervous system rather than the fight or flight, if you've heard that term before. The fight or flight is kind of the stress part of our nervous system. That's when we have increased blood pressure, increased heart rate, our sleep cycle gets diminished, our digestion gets diminished, our healing gets diminished, because the body's in this stressful state. It thinks it needs to fight or flee for its life, so it's not worried about all of those other functions. But research shows when we actually start getting adjusted and we actually start fixing alignment, the body shifts into what's called this rest and digest state. That's where we can have normal sleep cycles, improved digestion, decreased pain levels, better concentration, all of these things that we hear about from our patients on a regular basis. So between making sure we're exercising regularly, making sure we're improving our alignment and getting adjusted, making sure we're limiting artificial light before bed, whether we're wearing the orange glasses or whether we're just avoiding those types of light, those are all things that we want to do to increase sleep, which is going to increase our healing overall.